Okay. Now let's look at those harmful activities, because for you to be proud of your mouth, that means there are some good practices you carry out. But let's look at on the flip side. Let's look at those harmful activities human beings carry out, and it has a way to affecting their oral health.
Okay, first of all, there are, for example, like you rightly said, things that we, on the flip side, yeah. So number one is smoking.
Okay.
When you smoke, it has lots of consequences. Apart from staining your mouth and giving you a bad breath, it can also lead to oral cancer. In fact, the carcinogenic component of tobacco has been largely proved to be one of the commonest cause of oral cancer. So that's one. Number two, using some objects, to pick your teeth, for instance. We always tell people toothpick is not the best, even though it can help you in certain aspects. But we'll recommend that you use a floss. It's safer. That's another one. Another thing that people do practice is that they tend to brush with a very hard toothbrush. For instance, they have this compulsion that they must brush with hard toothbrush, and they must brush forcefully, and they must brush all the time. So eventually they get to harm their teeth. So that's another one. Other things that people do, drinking some herbal concoction that may stain the teeth, and so on and so forth. Then again, there's a popular one. People try to artificially create a gap tooth. Okay, so by creating a gap tooth, you are destroying the tooth, structure where you create that gap tooth, and eventually it's easier for holes, to get into the teeth from those defects that you had created.
Now, one wonders, because you just brought up a very good point where people try to, artificially create a gap tooth, and this day is being, celebrated by dentists, and except they go visit quacks. This process of trying to create an artificial gap tooth is carried out by dentists.
No.
So they have some quack somewhere that. So talk to us on that.
First of all, let's clarify. Gap tooth can be natural, but on paper, on book, it's part of a malocclusion. So it's not ideal the way it should be. But if you have a gap tooth, fine. But to artificially create one, you create defects on your teeth. In fact, people come to the hospital and pay a lot of money to get braces on to correct a gap tooth. So for us, gap tooth is not ideal. But if you have it and you're okay with it, fine. But you shouldn't go all out to go and create a gap tooth. And no qualified dentist in his right mind should artificially create a gap tooth, because there are consequences. But of course, the quacks, they are there for revenue. Whenever you come to them, they will accept to do anything just to make money.
Yeah, and I'm very sure your council is working real hard to ensure it gets the quacks out of the system.
Yes, the Nigerian Dental Association, in extension, the Nigerian Medical Association, all over Nigeria, and specifically in Cross River. There's a recent drive. We've been doing well, but I think we need to do better because the quacks are still out there. We may be able to reduce the menace of quacks, especially in the metropolis. But what about the other
hinterlands?
The hinterlands, so the Cross River North, Cross River Central, and the rest. Are we able to make sure that quacks are not there? If the quacks are not there, do we have enough manpower to cover the gaps that those quacks, the needs that they try to meet?
They're trying to fill.
Yeah. Yes. Do we have enough manpower to cover them?
Okay, I'm sure you just have to keep pushing, because certainly they will be out of business very soon. That's the quacks. Now, let's look at, you mentioned of oral diseases. Can we get to know a few of them?
Okay, the common one that most people have is gum diseases. You see some people, when they brush, they bleed. And when you look at their gums, they are swollen, they are red. So we call it gingivitis. Very common. It's one of the commonest diseases in the world, because if we examine everybody's mouth, we probably get to see gingivitis. There are different levels for different individuals. So that's quite common. Another one is dental caries. Dental caries is, in other words, tooth decay.
Okay.
Yeah, so it's holes on the teeth. That's another one. Then you also have dental caries advancing beyond the hole to cause toothache, to cause swelling, and all of that. We call those ones like dental So there are other diseases. Periodontitis is when it goes beyond the gum and then it's not affecting the supporting structure of the tooth. You see the tooth becoming mobile. That's another disease. There are certainly other ones. Oral ulcers due to infections, oral manifestations of systemic diseases. For instance, there are some certain diseases you have. If you have a renal failure, if you have diabetes, it will manifest in the mouth. You might actually be the first person to make the diagnosis. It could be from the breath, it could be from the type of ulcer you are seeing in the mouth. It could be from other features in the mouth. Bleeding can also be one of the first thing the dentist might notice for a child who has, for example, leukemia or lymphoma. So you can actually make systemic diagnosis from the mouth. So these diseases are out there, but you won't know until you have a professional look at you.
Okay, are there some underlying diseases that impact negatively on the mouth, on the oral health?
Yes, I give you an instance. The commonest one that we talk about, HIV/AIDS. There are oral manifestations of HIV/AIDS in the mouth. It could manifest as ulcer, manifest as cancer, manifest as gum, periodontal diseases. Okay, so things like leukemia and lymphoma, they also have their oral manifestations. Okay, and a whole lot of them. Gastrointestinal disorders like Crohn's disease could present as ulcer in the oral cavity. Okay, even things as simple as malnutrition. Okay. Things as simple as vitaminosis or reduced vitamin levels in the mouth, hypocalcemia, and the rest. They can manifest in the oral cavity.
We see some very well-to-do parents. They don't joke with their kids, and you see them pumping a whole lot of chocolates and ice cream for their children. I'm sure. What's your position on that?
Okay, there's a whole lot of debate on chocolate and refined sugars generally. They are well known to cause tooth decay. Okay, so we advise and recommend for children, they must take chocolates, biscuits, refined sugar. They must try to take them within the meal time. So as you're having if rice is your main meal, after eating the rice, you can quickly take chocolate so that you don't space out the time that you have this chocolate and increase the time that they have contact in the mouth. Then, if you brush twice daily, 12 hourly, that's twice daily, you stand a chance to remove some of those sticky chocolates. But if you don't, those sticky chocolates and biscuits and all of that and ice cream will have longer time to stay on the tooth. And when they stay on the tooth for a longer time, they encourage bacteria to produce some of their waste products that will not help to dissolve the tooth. And that's how the cavity starts.
Okay. Yes. So let's look at the proper way to take care of our oral health.
Okay, first of all, there's what we call rule of two. One, you have to brush twice daily. That's the first two. Then you have to brush at least 2 minutes. Each time you brush, at least 2 minutes. Then you have to see your dentist at least twice in a year. So those are the basics. But there are more details about how you're going to brush, the technique you are going to use, the type of toothpaste, the type of toothbrush you are going to use. So those are the basic things we may not have time to talk about. But if you observe this rule of two, you stand a better chance of multi-binocular. Because if you see a dentist in January and see the dentist again in July, if there are cavities that are developing, the dentist will see it and will nip it at the bud. It's always cheaper and easier to treat oral diseases at their early stages. Once they advance, you spend more time, you spend more money. They cause pain and all of that for the patient eventually.
Let's look at the symptoms of oral challenge.
Okay, the commonest symptoms people present with is pain, toothache. Okay. Other symptoms could be bleeding while brushing. It could also be bad breath. So it could be that the person do not like his appearance, which is quite common these days, and justifiably so. Because if I'm not proud of the way my teeth are, it's a symptom. I can complain, I don't like the way my teeth are to a dentist, and then we start looking for solutions. It may just be the color of the teeth. It could range from, could be ulcers, it could just be that I'm not able to move my tongue properly, I'm not able to close my teeth properly, I have pain when I close my teeth. when I eat, food gets to stuck in between my teeth. So these are the whole range of symptoms that patients could present with.
And maybe the last but one, let's look at treatments for those who are suffering from, challenges had with their mouth.
Okay, your first duty when you have a challenge is to see a dentist. When you see a dentist, there are things that will make you know that this is a properly trained dentist. Okay, so you find out, ask. I'm encouraging the citizens to be bold to ask questions when you meet a healthcare practitioner, whether in the government setting or the private setting. Ask the person, are you a trained dentist? Are you a specialist? Can I see your certificates? And so on and so forth. Be bold, it's your health, because if you fall into the wrong hands, there will be consequences. So that's your first point, of course. See the dentist, and then the dentist will take it from there. So treatment could just range from just ordinary advice. Maybe you are brushing, you have sensitivity, and I noticed that it's because of the way you are brushing. Or you have some oral pigmentation, discoloration of your gum and your cheek, and I notice it's because of the kind of toothpaste you are using. The treatment is just a simple advice. Stop this toothpaste. Maybe use another one. Stop the way you're brushing. Then it can also range from advice to simple treatment like cleaning. Clean your teeth. We call it scaling and polishing. It could range from there to fill the holes in your teeth, restore them, extractions, gum treatment, and so on and so forth. Those are some of the simple treatment that we may offer.
Okay, I think this one just came up when you were to work. Let's look at chewing stick versus toothpaste.
Well,
which is more hygienic?
Yeah, toothpaste, obviously. Toothpaste, the way they are designed, they've been researched and designed to carry out their function. One, they have detergent that will help them remove dirt. They have fluoride that will help to maintain the teeth. And then when you're using the toothpaste, most times you're using a brush. And the brushes are designed, and the bristles can go in between the teeth. And then the bristles do not just pull out from the head of it. But when you think of chewing stick may not be able to go in between all the teeth. Okay, and then the strands of the toothpick can actually break out and remain in the gum. And once they remain, of course, they will cause some periodontal diseases. So toothbrush is far better than that. You can use toothpick when you don't have access to toothbrush.
Okay.
But it should be finished short.
Okay, so let me quickly chip this in again. How long should a toothbrush last? Some people get toothbrush because of maybe economic situation. They can use it for 1 year, some even more. So how long should it?
See some of them as wide as a probe. Okay, yeah. So I think that's the rule, part of the rule 2.
Okay.
Rule of 2 is 2 months. However, within these 2 months, if you notice that the bristles are no longer well oriented and straight, even if it's just 1 week, I think you should change it. But your target should be 2 months.
Okay.
Yes.
Okay.
Then some of them are color coded.
Okay.
When you buy the bristles, if they are color coded, the company will mention it on the label. They have a color, let's say blue. Once the blue fades or changes, you should throw it away.
Okay, Doctor, I trust me, it's been an engaging moment here. Quite a lot has been said. Let's get your advice on a day like this to those watching us right now.
Yeah, the final word I will leave as an advice is 1, the rule of 2, brush twice daily. And let me also state that brushing twice daily, the timing is important. So in the morning, it's better to brush after eating. Then at night, you brush last thing before you sleep. That way, you break the cycles of this deformation and everything. Then when you're brushing, bring out 2 minutes. It's not so much. Bring out 2 minutes and brush. See your dentist twice in a year. And then your toothbrush shouldn't last beyond 2 months. So that's the first, that's the advice I'm looking for.
All right. Thank you so very much. We heard it from a consultant oral medicine and pathology from UCTH, Dr. Nonso Onya. Thank you very much, Doctor, for your time on the show.
Thank you very much.
I'm sure we've learned quite a lot, especially those who can keep their toothbrushes for 6 months, 1 year. Doctor said clearly 2 months, or if you have a specified timeline, you can dispose of such toothbrush. Thank you very much again. Thank you. We hope to have you more to look at our oral hygiene.
Sure.
Good morning, Cross. We return shortly. Don't go away. Stay with us.